just confirm your details on our system here. And date of birth. Is that one your email, or that lower one there is the one you're using now? Okay. And your phone number, so we can easily contact you about your results. Right. The last 4 digits again, sorry. There we go. Right, so you are here for the cranial nerve exam. That makes sense. There's a large block of time there cut out for you, so it can easily be condensed down to or simplified into testing your five senses, right? But you actually have 12 cranial nerves that we have to test out today. And I'm going to be describing what we're doing as they're happening, and I'm going to ask for your consent. So, speaking of smelling, we can test that one out first. That is your olfactory nerve. Rare to test because, well, I can just ask you if you have any differences in smells, and then you could say no. But if you requested here in our system a more detailed look, so I can show you. I have here a series of vials containing different scents. Here. I don't need you to be a perfume expert or anything. I don't need you to tell me the top notes and the middle notes. Just tell me something you smell, and I may repeat these. So don't think that just because one smells like peppermint that it won't come up again. This one, smell this please. Yep, strawberry. And I'll grab another. Smell this one please. Coconut. Yeah, I'd say it's close to coconut. Okay, this one please. Peppermint. And let's get this one. That is the peppermint again. The peppermint is quite a strong one. Lingers. Okay, this one. Smell this one, please. Yeah, a bit tough one. Yeah, you're right. It was citrusy. It was the orange or the lemon. Okay, this one. Smell this one, please. Deep breath in. Yes, you're right. That one smelled like coffee. Okay, let's go for this one. This will be the last one. Last one. Smell this one, please. Deep breath in. Yep, that one was the strawberry again. So these were the 5 different vials. Sense of smell is fairly normal. Good. And we have rat tests over there, but I don't think you need it. We tested your temperature when you walked in as well. The next one we're going to test out is your optic nerve. Okay, first of all, I will assess your pupil. Warning here, I have a light. This is going to tell me the different sizes that your pupils can get. It says here your pupil gauge. That's upside down for you. Now, pupils normally are smaller in bright light. That is what the light is for. See how quickly it reacts to the light. We're also going to assess your pupil shape. Your pupils can look a bit what we call peaked if you have some sort of head injury, and that's mostly what I'm looking for with that shape assessment here. They should be nice and round. I will test it out on me first. See here, pretty round. Pretty round. Also the symmetry, hopefully you can see that my pupils are similar sizes there. I would just cup your face a little. Actually, before I do that, before I touch your face, I will don some gloves. Let me open a nice first set here of our disposable nitrile protective gloves for your safety. Pinky got a bit stuck there. Okay. Alright, so I'm gonna just cover one eye a little bit while I test out your other eye. So, slightly cover. The other one. Yep, and both at the same time for that symmetry there. Yes, it looked perfectly fine there according to my gauge, and the other ones I've seen on average. And the shape was lovely and round as well. Next way we can test your optic nerve is with the Snellen chart. You probably have seen this before. Okay, I'll just hold it up for you. Just tell me, read here, of course, but then what is the lowest line you can read here? Okay, you think you can go for number 11 here? Okay, read it out to me. Yep, good. Good. Yep. Yes. Visual acuity is normal, I'd say. Now, do you have any history of color blindness, let's say? Maybe even in your family, not particularly just you, but... Yes, normally we do something called the ishihara test. You might have seen them before. They are the circles with numbers or maybe an image on them. Good one. Yes. Now, obviously, to me, it's quite clear to see a 74 here, but the way that it is curved, the way that here these lines are a little lighter, a little bit actually closer to this orange that I see, and meant to blend into the green here. Some people might see a 1 instead of the 4. That's perfectly normal as well. Or rather than normal, I'd say it denotes a milder version of a color blindness. Let's see here. Okay, this one is a bit harder. Now, red-green is the most common type of color blindness. You should be seeing here a 45. 45. Yeah, and you probably know if you are colorblind or not. This next one, we're still testing your vision here. I want you to focus on, let's see, what is a fixed point here? I want you to focus on the sun in the middle of my flag here. And I'm going to wiggle my fingers at different points. And you are going to tell me when you see which hand moving, right? Just tell me left, right, both, okay? Very good. Yep. Do you notice that you clock one movement over the other one quicker? Yep. Yep, perfect. And if, for example, you only notice one side when I'm doing both, that is called visual extinction. No, not the worst thing. You can still tell if I'm doing it individually. If you'll tell me when my fingers go out of your field of vision here. Yep. 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 Very good. Very good. Very good. Very good. Now there are 3 nerves that control your eye movement and your eyelids. And I will be testing them all with this one movement here. So if you could focus on my finger here and move it without moving your head, just follow it along. Again, I'm seeing your eye movement here. Here. So if you could do it again, focus on my finger, do not move your head. Just try to see. So the 5th cranial nerve we're going to be testing today is to do with your facial sensation. You can tell me yes or no if you're okay with me touching you. Okay, so I need you to close your eyes and we'll touch you with this sharp side, quote unquote. It's not actually sharp, but you know, you'll feel some coolness to the touch compared to this dull side. You know, circular, it's very soft compared to that side. And you'll tell me sharp or dull. Okay. Sharp. Sharp. Yep. Dull. 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 Yep. Good job. Sharp. Dull. Sharp. Those both were dull. Dull. Sharp. And dull. Yes. This nerve also controls your chewing. So I will need you to clench your teeth for me while I, yep. I want you to open your mouth while I apply some resistance, okay? I want you to open your mouth while I try to keep it closed, okay? You could easily open even if I... So now we're doing the facial nerve. This is to do with your facial expressions. Like I've said, I've experienced Bell's palsy. Okay, now I'm gonna ask you to make certain expressions. If you could raise both your eyebrows, lift your eyebrows, and if you could lower them at the same time, please. Raise them up. You're surprised. And if you could close your eyes, really scrunch them up. Really scrunch them up so I can't see them. Okay, that's good. You can open them again. One more time, close them. And open them again. Thank you. Okay, I want you to puff out your cheeks. Puff out your cheeks. I know you're wearing a mask. But puff them out and don't let me deflate them. Okay. Okay. It looks symmetrical. So you're doing well there. This one is for the vestibulocochlear nerve. This is to do with your sound. It also controls balance. Now, have you noticed any differences in your hearing lately? I see. That's not so strange, but I'll note that down. I'll note that down for you. And with your balance, I see. I'm going to say 3 numbers and you're going to repeat them back to me, okay? 12, 64, 29, and then you will repeat back to me what you remember. 12, 64, 29. Yep, perfect. Another time. 89, 74, 55. Okay, repeat them back to me, please. And then, yep, the 55. So now you know what the test is like. I'm going to block one of your ears by rubbing the tragus. Okay. 3 numbers again. 11, 48, 91. Repeat them back to me, please. 11, 48, 91. Okay. Other ear. 34, 28, 25. Repeat. 25. Yep, that was the last one. Good job. Like I said, this one has to do with balance. So this next test has to do with sharply turning your head. If you have any neck problems right now, you can tell me. We can move on. And I will just focus on the words that you said to me about your recent changes. Focus on my nose. Oh, make it more clear. Focus on my nose for this test, the entirety of this test, even as I turn your head, okay? So I will hold your head, one hand over each ear, and I will turn it, okay? Keep focus on my nose. Okay. Thank you. Yep, one more time. Okay. To the other side. This one, I'm going to test out your accessory nerve. It controls your motor skills with your trapezius muscles and things like that. So I want you to resist me pushing you down. So I want you to put your shoulders up, okay? Okay. Yep. Again, resist. 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 Okay. Resist. Yep, pretty good. Last time. Okay. Now, turn your head a bit as you resist this one, okay? Okay. Yep, you're staying in your position, just like turning, okay? Okay. Alright, slightly turning to the other side. Alright, do you notice any difference in your hearing between your different sides of your hearing? Yeah, so for example, you're hearing this sound mostly on one side and the other side. So let's see. Are you hearing the sound mostly on one side or the other side? Are you hearing this sound mostly on one side or the other side? This one, you hear mostly on one side or the other side. Okay, it seems like, not everyone's senses are superhuman or the best, but it seems like, you haven't noticed any differences, whether you already knew you were colorblind. Yeah. Thank you for coming in today. I will see you next time. I will update your details.